Hey guys, I just want to talk to you today a little bit about vomiting and diarrhea. Those two things can be caused by a virus or either a bacteria. So the treatment for both are very different. So you'll want to treat vomiting by keeping your child from eating or drinking anything for at least 4 hours after the vomiting starts. After 4 hours, you can start to introduce clear fluids that contain electrolytes like Pedialyte, sugar-free Gatorade, even some broth. And then after 4 hours of tolerating that, they can have something like toast, a banana, something very bland to keep on their stomach. If they're tolerating that well, then you can start to try to move to their normal diet about 24 hours after the vomiting starts. After the vomiting subsides, you'll still want to kind of be wary about acidic foods, greasy foods, and fried foods. If at any point during that course they start vomiting again, you'll need to back up and go nothing by mouth for 4 hours. The treatment for diarrhea is a lot different. You'll need to start with high protein diet, things like peanut butter, chicken, and beef. You'll want to stay away from those carbs like vegetables, fruits, and breads. Also, the diarrhea should not last more than 3 days, and it should not contain any mucus or any blood. If it does, then you'll need to call our office immediately. Something underlying may be going on. Also, if your baby under 6 months of age is having vomiting or diarrhea, you'll need to call us as soon as possible because that can be indicative of other things. Something else you'll want to watch for is their dehydration status. Babies will get a sunken fontanelle, which is their little soft spot on the top of their head. If that becomes sunk in, that means they're dehydrated, and that's an emergency. So you'll need to call us or go to the emergency room. For older kids, if they aren't crying whenever they get upset, or if they're not pee-peeing enough, or at least one time within 6 hours, that's usually our limit. If they're not peeing by the end, then you'll need to call us and bring them in. Also, you'll want to watch for those fevers. It's not uncommon for babies to run fevers whenever they have vomiting and diarrhea, especially with that nasty tummy bug. But if it does get over 100.4, you can always call us. That's just low grade. If it's above 102, then that's something more serious and we'll need to see them in office.